I think the healthiest mouthwash ever is...
So many people use poor quality mouthwash thinking it's a good thing, but they get rid of good bugs.
Totally. So the saliva is what protects teeth, right? That's why I always insist. Once you pass 60, 40% of over 60-year-old people, they tend to have less saliva because they're either on high blood pressure tablets, depression, or hay fever, or many tablets that you take that create an environment where there's less saliva. So if there's less saliva, the teeth are not protected. And then the mouthwashes. So I think the healthiest mouthwash ever is salt water, for example. It doesn't taste very good, but salt water is fantastic for gums. It's
Gargle.
antibacterial.
Yeah, it's antibacterial. Of
It's
course, I never
antibacterial.
thought of that. I'm going to start using that as a mouthwash. Have my sea salt by the sink. Hi everyone, welcome back on the Eat, Burn, Sleep podcast. I'm so excited to have Sandra with me here today. I've been trying to have this fabulous guest join us for a while because she is not only an incredible dentist, but so charismatic, beautiful, smart, and engaging. Today we're going to talk about oral health. As you know, my specialty is gut inflammation and gut health and chronic inflammation. And many people don't understand or don't realize that the gut starts in the mouth. The gastrointestinal tract starts in the mouth. And the way you deal with your oral health has a huge impact on your overall health. And Sandra is here to talk to us about it today.
Thank you so much for having me. I've been very excited the whole day.
Thank you.
And it's a pleasure, and I think you do fantastic work. And I think this is the present and the future of health, to think about the relation of the gut with everything else, being the second brain, and the direct connection it has with the oral cavity. So yeah, thank you so much.
Pleasure. So, Sandra, we met because I came to you as a patient.
Yes.
My lovely friend Anushka recommended you, and I had never seen a dentist work the way you do. Extremely, if I can say, as a patient, you were amazing in the products you used, how you were careful for little toxic things to not go into my mouth, how you protected everything, how it was not invasive, very quick recovery time, amazing results. And I was like, wow, I've never had a dentist be so efficient, so mindful, so into results as you are. So you have, before we dive into oral health and the impact on overall health, I want to learn a little bit more about how you work and how you came to work this way.
Well, it's kind of, I come from a family of doctors, and but I was always very interested in how you feel as a patient. And I would go to dental surgeries, to dentist surgeries, and I would say, why is, from the light to the music to the smell, all these kind of things, right, that I felt really impacted an experience. It's like walking into a hotel. You always know how, Soho House smells, right? Because they have a unique scent, lighting, and even furniture, right? So I kind of wanted to recreate a nice experience. And then be in, a dental environment, something so scary, I wanted to try and help minimize that by being gentle, using things like lip balms, things that, normally people don't think of, and that make your experience much nicer. And then, as you've experienced, the rubber dam, for example, something that everyone fears. It's when you're having, a tooth drilled, that the water goes to the back, that you choke, all these things that can be avoided. So I was always very, very curious of how to do the journey minimally invasive and nice for everybody. So
can you explain what the rubber
dam?
The rubber dam. So as a patient, you put a little plastic
piece of rubber, yes.
Yeah, and the tooth was isolated.
Yes.
So nothing went down my throat.
Exactly. So there are many purposes for that. But first of all, when you're removing things like an amalgam, which is toxic, you don't want any particles going back to your saliva that you can potentially swallow again, right? Then obviously when you want to keep the tooth that you're working on as clean as possible. So the only way is to isolate it from your own saliva and from anything else. And in a case of a filling, for example, or you're cementing a crown, you want the environment to be clean. And the only way is to keep it dry and see what you're doing, right? So by isolating the tooth that you're working on, you have everything covered. And then the patient doesn't have any water, they just have to swallow their own saliva. So it's I think that the way it creates like a feeling of having everything covered, and then the fillings last much longer in the case of the fillings, or when a crown has been cemented under rubber dam. All the studies show the longevity of that crown will be much more than if it was just done, contaminated with saliva, with water, with other things.
So interesting.
Yes.
You wonder why everyone doesn't work like this.
Because it's time consuming. And then people want to rush things because obviously if you rush, you see more patients, more money. And this is where the game starts.
I see.
Because it does take more time. But I believe that, I'm pretty fast with the rubber dam because I've been doing it since, the beginning, since I was at uni. And then if you start working in clinics, it's more material, it's more expensive. So they start cutting things down. So this is when you have to say, no, I'm not going to compromise. Even if I have to pay for it myself, it is a different way of working, right? And in the pandemic, they obliged every single dentist to use rubber dam. But then when the veil was lifted, everyone went back to working like they did before.
So interesting.
It's sad.
It is. And, at the end of the day, it doesn't matter what you do.
Yeah.
If you're passionate about it and you care.
Yes. It's the care.
It is the care. Whatever your job is, if you do it with passion, love, and care, you start excelling.
Yeah.
But there's got to be that investment from the person working, and this is what you're doing. I remember the first time I came to see you, we had this conversation about, you see all these patients come to see you and get their mouth in order before starting chemotherapy, these cancer patients. Yeah. So can you talk to us a little bit about that and why it is so important before starting chemotherapy, for example, to have a healthy mouth?
It's actually the last patient I saw before coming here had already started chemotherapy, and I was very upset because if it would have been me, the oncologist treating, I would have not allowed this gentleman to start chemotherapy because he had a disaster of a mouth. So if you think about what chemotherapy does, it completely, reduces their immune response. So all of a sudden, you're going to, everything goes down to zero. So if you already have an existing problem in the mouth, it's just going to make it worse. And radiotherapy as well. So if you have bone loss, if you have gum disease, everything will become much worse. And the response to the treatment and to fight cancer is reduced because of this. So normally we work a lot with oncologists, and what they do, they send us the patients for clearance once they've been diagnosed before they start treatment. And I'm very thorough on that.
So I understand how if you have gum disease and your immunity is low, that is going to worsen faster. But how does it work so obviously the relationship from what you said is binary. So poor oral health means the chemo works less well. Why is that?
Because of the immune response that you have. And, it's the relationship with everything. In the blood is a relationship with the blood supply. So yeah, it's very, very bad to start chemotherapy with an active condition of some sort in the mouth or anywhere else. Yeah.
Makes complete sense. I mean, there are more and more studies showing that the oral microbiome is linked to so many things: infertility, Alzheimer's disease, more and more things.
Yes, cardiovascular issues.
Yeah,
depression.
So because it's basically the microbiome, yes. It starts in the mouth. So maybe the problem that is being treated pre-chemo might have been one of the factors impairing the gut,
yes.
impairing immune system health, raising chronic inflammation, and maybe triggering that gene, that cancer, activating the gene expression for cancer.
Definitely. I definitely agree on that. Yeah. Anyway.
Okay, so tell us more about all these studies that are coming out. And because before, so I remember when I started looking into chronic inflammation around 15, 16 years ago, I remember this conversation with my hematologist who was following me for the issue that I had, autoimmune hemolytic anemia. She knew my interest in diet, and at that time, when I started with my issues, like 2008, 2009, there were not that many studies showing the link between diet and autoimmunity. And around 2012, she said to me, we're seeing more and more things coming out about the impact of gut health on chances of having diabetes, chances of being overweight, chances of Hashimoto's, all of that. And do you feel that now finally they're extending these studies to the mouth, which really is part of the GIT?
Totally. I'm seeing more and more patients, and the way I do my consultations has changed a lot.
Okay.
Where I ask about vitamin levels. Are you taking any vitamin supplements? Like what is it? What's your day-to-day diet like? Because it's very important. Like a person with, especially in London, the majority of us has low vitamin D. Vitamin D3 is the most important for the mouth. Vitamin C, another one. People extract teeth and they don't prescribe. Just a small example. Vitamin C should be prescribed together with vitamin D before you have a tooth extraction, because it helps a lot in the healing and the inflammation. Things that you don't study in university, right? But nowadays we have all the tools to say, okay, your response to the treatment is going to be so much better in your healing if we just take, these little things in account.
Oh my God, it makes so much sense. But you see, I wouldn't have thought of it.
Only for a small amount of time. So say vitamin C, you would double the dose, but just the week before the extraction and the week after.
Okay.
Because obviously then you can have, digestive issues, and the same thing with the vitamin D. Then another thing that is shocking is the amount of wisdom teeth that have been extracted, and they create, because they haven't been removed in a clean environment, and they haven't been probably cleaned the environment that, the remaining bone where they were, and they were once infected. That's why you remove them. And all of a sudden they create like a little capsule, and they end up with the years creating what we call like a sinus, like an infection, a chronic infection that stays there. And that has been linked with Alzheimer's, with depression, and all of a sudden, or even, neck pain, back pain, and all these. We started seeing this data with athletes, that they wanted to enhance the performance. And they were top athletes, but they needed that extra, right? And they wanted to just say, okay, what is it that I'm missing? I'm doing everything right. And all of a sudden you get x-rays done and you're like, let me see this. And when you do CT scans and you realize, okay, this one has a root canal that has an infection, or this one has this area where he had a tooth extracted, and what's going on here? And then, once you clear that, it just enhances all the performances. It's shocking.
Oh, my goodness.
Yeah. Root canals are a big topic, very big topic. Yes.
Oh, my God, of course. Because if you have a chronic infection, it's going to start affecting everything. But how do you get that checked?
Go into the dental checkup. So, for example, root canals, if I said, okay, every tooth that has a root canal needs to come out, I would have my license removed, at least in this country. In Germany probably not, because they're more advanced when it comes to biological dentistry. But if you think about it, it's a dead organ. So if you had a dead organ anywhere else in your body, or dead tissue, would you keep it?
Yeah.
You would have it removed, right?
Yeah.
So the majority of root canals are not done in a clean environment. They're not done under microscope. They're not done in a certain way. And with the years, bacteria starts filtrating, and teeth start developing infections.
So for someone who's had a root canal done, or like I got wisdom teeth removed when I was a teenager. I still remember clearly. How would I know today if I had a chronic
CT scan?
Would it be
scan.
possible that at 46 years old, since I'm 14, I have a chronic infection going on there?
Totally.
Oh my God.
I spoke last week with a colleague of mine in Portugal. He's an incredible biological dentist, and he was telling me a patient that she was suicidal. She had been to the psychiatrist. The psychiatrist kind of gave up on her, but she knew there was nothing wrong with her. She knew there was something wrong with her body, and she couldn't, pinpoint. She was taking antidepressants. She was taking all sorts of things. And he did a whole study, and he found that an area where she had a wisdom tooth removed had encapsulated infection. So the treatment of that, so he did a CT scan, which is a 3D scan X-ray, and there you can see. And the treatment is to open again and clean with ozone the area. And then it heals and symptoms just disappear. It's shocking. It's really shocking.
Wow.
Yeah.
This is enlightening.
Yeah.
But it makes complete sense.
It does. Totally.
Because, of course, if you have running inflammation, and that's going to impact your microbiome, and depression is linked to chronic inflammation. And in fact, I wrote, today is World Mental Health Day, by the way.
Yeah.
The day of recording, or the 10th of October, today is
10th,
World Mental. And when I was at nutrition school, the final paper I wrote was on depression. So my specialty is inflammatory bowel disease, because that's what I was diagnosed with. But whenever we were asked to write papers, I would always pick topics that I didn't know much about to educate myself further. So at the beginning I did endometriosis. My final paper was depression. And one of the things that really stayed in my mind was a study showing that, all MMDs, major mental diseases, are linked to chronic inflammation, and people have elevated inflammatory markers. Bipolar disorder, schizophrenia, depression, they have elevated, CRP, ESR, elevated inflammatory markers. And it said these exact words: inflammation is like a switch when it comes to depression.
Wow.
And you can switch it off. And you're talking about medication. There was this other study showing that about half of the people who are prescribed antidepressants report feeling no better 18 months later, because when you're inflamed, it creates medication resistance because of the immune system dysregulation. So, of course, meds don't work anymore. Wow. So this poor patient you're describing, she was textbook this because of the infection that was going on.
In an area where a tooth had been extracted probably 20 years ago.
Insane.
Yeah.
We should almost all get checked.
Totally. But that comes back to prevention, right? I always say when you buy a car, you do the MOT, you take it to put petrol, you take care of the car. But you go to the doctor when you have a problem. We don't think of prevention. We're not obliged,
Yeah.
Insurances should say, okay, if you want my insurance, you should, once a year, you're going to have to see the doctor, you're going to have to see the dentist, you're going to have to do certain things. It should be an obligation, but we don't work on prevention. It would save us so much money to work on prevention.
Not only on the healthcare systems, but, productivity, not taking days off, happiness, being happier, enjoying life more.
Yes, definitely.
Wow,
Holidays. The sun. But it's true. It's shocking. And we don't work on prevention at all. And me being the first one, I don't go to the doctor unless I have a problem.
So if let's say I'm a listener and I hear about this fabulous dentist, Sandra Martin, who's in Harley Street, 107 Harley Street in London.
Thank you.
If I go and see you, what can we do to optimize my health?
Definitely start by doing scans whenever you've had previous dental work done.
Okay.
A full exam of what your day-to-day life is, what you eat, what you drink, the sports that you do as well, because you might be your sleep. How is your sleep? That influences a lot. You might be grinding your teeth, so therefore you're not resting.
Yeah.
What is your day-to-day routine from an oral perspective, right? How many times you brush your teeth, Do you use manual? Do you use electric? All these things that influence. But when it comes to optimizing the health, definitely, it's checking gums, checking previous dental work or work that needs to be done. Yeah.
Interesting. So everyone go and get checked.
Definitely. When it comes to that, it's especially optimizing your health. I just had a patient recently that had Hashimoto, and she's almost got rid of it through, optimizing her health. And they've given her medication for 15 years. Nothing worked until she said, you know what, I'm going to go to an holistic doctor and find out what's wrong with me.
Yeah, we helped many people on the
biohacker now.
yeah. I mean, Hashimoto's, my mom suffers from it.
Wow.
And I've seen her take the meds her entire life and still eat gluten when we know that the protein of gluten is very similar to the protein in the thyroid. And if you have a gluten intolerance and there is a strong link with Hashimoto. So my mom was like the opposite. Let's be unhealthy and take the meds. But I've seen incredible results on the Eat, Burn, Sleep lifestyle with people having the nodules go.
Really?
Yes.
Wow.
Yeah.
Wow. You're helping a lot of people. I'm not sure if you're aware of that. Yeah, you are. From experience, you see, you solved a problem.
Yeah.
It's all about solving problems.
Yeah, I love solving problems.
Yeah.
And I love complex cases. As soon as
Me
someone
too.
calls me with a complex case, I'm like, yeah, no one could fix you before. Come to me.
But it's like everything. Whenever I hear the word cancer, I'm like, oh. And I see an unhealthy person undergoing cancer, undergoing chemo, radio. I'm like, first of all, one of my dearest friends is an oncologist, fabulous oncologist. She used to work in London in Harley Street. Now she's back in Spain. And she says the first thing, whenever they're discovered cancer, I put them in turmeric, just turmeric pills. Something nobody does, right? It's the biggest anti-inflammatory.
Yeah.
Something
it's
so simple.
Important. Yeah. I mean, we've had amazing results in terms of response to chemo, reduction. I had this lady who had a carcinoma, and her hematologist couldn't believe her blood tests. Yeah. I was like, what have you done? She said, I'm just following an anti-inflammatory lifestyle. And the body is wired for healing, so we can bounce back, but it's a question of giving the right tools and putting in the right ingredients to give the chance for the body to come back. So in your day-to-day, how do you keep up with the clients? I know you do a lot of celebrity clients, all the glam. I know you do a lot of charity work and your research. How do you structure a day? And I know you're super healthy. I mean, you're the picture of health. You work out, you eat well. So give us, for all the women out there and men who are juggling a lot, how do you stay on top of your game?
I think it all comes from self-love first, and loving the body that you live in. That you just get one body. You just get one body. You get one set of teeth. So you have to, really take care of yourself. For me, meditation is very important. So I start my day, like Oprah would say, I start being thankful. Always. I have a little, a notepad, and every single morning, even if it's for 1 minute, there's always something that I'm thankful for. And I don't know, it kind of sets it's my moment in the morning to do my wish list, why am I thankful for, what am I thankful for, and then my meditation. And then that kind of gives me the peace to start the day.
There's a study showing that a gratitude prayer instantly improves gut health.
Really?
Yeah.
Wow. I want to see that study, but I believe it.
Because of the brain-gut connection, and the majority of neurotransmitters are produced in the gut. And when you have gratitude, you have a sense of calm that immediately washes over you, reduces cortisol, rebalances, resets the central nervous system, and your gut health improves.
Yeah. So 5% of the neurotransmitters from the gut goes to the brain, you're right?
Yeah.
Yeah. So then I start exercising. I do my exercise in the morning. I used to do it in the afternoon, but I was dead. So I had no energy. And that gives me like the boost. I'm a very energetic person. I always have energy. But that kind of gives me so much more energy. Even if I haven't slept, I try to never give up my exercise. Yes. And then, I started strength work, which, working the muscles, which is what, obviously, as you know, muscle mass is reduced as we age. And I found a lot of positive things in strengthening my body, for sure. That's been like a click in my life. And then just being passionate about like what you do. You solve problems. For me, it's like someone that comes in pain and I'm able to help. Someone that doesn't smile, and being able to change that. That's why I love charity, because you can make a change with your own hands. And
it's very rewarding.
That's very, really rewarding. Yes, definitely.
It's true. Our jobs are so rewarding. People say, "Oh, what you do is amazing." Yeah, it makes us feel amazing.
Yeah.
I realized this. I remember so clearly. One year we did Christmas. My mom lived in Brussels then. We did Christmas in Brussels, 24th, in the evening, Christmas Eve. And then, so we had all the foie gras, the oysters, the caviar, champagne, wine, opened the gifts, all of that, went to bed full. And the next day, my mom said to my brother and I, we're going to go and help. We're going to go and serve Christmas dinner at this convent with these sisters where a lot of homeless people came for Christmas. Wow. And so we went quite early on, where they're peeling potatoes, cooking, setting the table. So we basically spent the day doing this and connecting with people we would have never connected with before. Hearing a story, this one used to be a maths teacher, this one, and how there's a simple chain of events that can make you become homeless. I had no idea. And for me, it was a complete eye-opener. And also the fact that they had dressed for that day, so they still had that dignity and the sense of time, and it's Christmas. But what stayed with me was the sisters had been working. Over Christmas, it's the time they work the most, because it's a time where you want to be with your family, and a lot of these people have disconnected from their families, so they would come and see them. And we served all the food, and one of the sisters, there was no food for her. And the other sister said, "But you didn't eat today." And she had the biggest smile. It's as if she was high on something. And she was like, "No, it's fine." And I remember looking at her and thinking, last night I got all these gifts and all this food.
You were so
and I
full.
went to bed feeling okay.
Yeah.
And she's helped people all day, and that's all she does. There's nothing about money in their life, and she's high as a kite with happiness. And I understood in that very moment the power that when you give to others, when you make others feel good, it fills you up even more than what you've given.
Yeah, totally. For me, and I've done a lot of charity in Africa. Now the charity I'm part of is in Eleuthera in Bahamas, which is slightly different. Because the idea of what we're doing down there is different to what we used to do in Africa. But Africa is as poor as it gets, the countries we visited. And it was just, everybody was happy. And they were lucky if one family had one toothbrush. We were very lucky. And because they would share everything, right?
Wow.
And they were just happy all day long. And I said, what's wrong with us? Because they're happy. They wake up to nothing. They wake up and they're happy because they really live the present moments.
Yes.
They really do, because they don't know what's going to happen to them. The same thing happened in Eleuthera. The first year that I went with my nurse, Nassim, that we went down there. And I remember this lady, she had been 3 days in a row patiently waiting for a queue that she never saw, the end of. And we were wrapping up. It was actually a beautiful story. I could cry just telling you the story. But we were wrapping up. We had, done our week down there. And all of a sudden, one of the girls comes and says, "Sandra, you're the only one working right now. There's this lady you have to see." And I said, "No, come on. It's dark. We're done." She said, "No, she's been waiting for 3 days." I said, 3 days? So anyway, she walked in, and when I saw what she needed, basically all her front teeth all black, like she had cavities everywhere. Everything was a disaster. I looked at Nassim and I said, "We're not going to make it to dinner," So anyway, we start working, and there was a power cut, which is normal when you work in, places that don't have a lot. So no AC, obviously, and you're, like sweating. And anyway, the power cuts, and it was dark already. So I said, I need everyone that's right now here to come with their loops. The dental loops have a little light and help me.
Oh my goodness.
Because I can't see. I can't see. Sorry, I can't see, and there's so much that we need to do. So anyway, we managed to finish, and when we finished, it was like a movie. The lights went back on. I was like, what is this? So we give her the mirror. She starts crying. And I was holding it together, right? But of course, Nathan was crying, some other people, because it was really emotional. She was 20, she was very young, 23, 24. But she hadn't been smiling since she was 10, because she developed, cavities, and then all the teeth became black. And then, So anyway, I took her outside.
Goosebumps.
It was a beautiful story. I took her outside, and I see two little boys. Mind you, she's been waiting for 3 days, and it's been the whole day. So probably she got there at 6 a.m. This is 7, 8 p.m. Two little boys sitting outside. I said to her, are these your children? She's like, yeah, they're my sons. And there I started crying, because I said, if it was my nephews that I adore, they would have not been still here playing. We don't know, what's out there. We really don't know. And I'm dying to take them down to Eleuthera so that they just understand how lucky we are.
Yeah.
And we're talking about, Eleuthera is half an hour plane from Miami.
Yeah.
It's not that far.
That's crazy.
And the same with Africa. I'm from Canary Islands. In Morocco, which is 100 kilometers away, we see the African coast. People die because they don't have anything to eat. Basic things are not covered. And she came to see us to the airport, which is like a road. She came the following day, and she had to get 3 boats to come to the island where we were. And she just came to say thank you.
Oh my goodness.
So it was like she said, you've changed my life. And for me, it was...
Wow.
And I had a bit of crisis that year, because I was thinking, what's the point of the work I do? I treat vanity. I'm a cosmetic dentist. This doesn't make any sense. I don't do anything, And that trip gave me the purpose. I said, I was able to change her life.
Yes.
And she came last year, and I saw her, and now she comes for checkups.
That's so amazing.
It's incredible. So I said, we planted a seed where now she's so confident, because she feels good about herself, that she's changed everything.
Yeah, and she's improved her microbiome
Totally.
because there are no more cavities in her mouth.
Nothing. I said, okay, what do you eat? But then you go to the supermarket like you do. So when you go to a third world country, that if you're lucky to find one of these 7-Eleven shops, you see crisps are much cheaper than a bag of, of spinach.
But same here.
Yeah,
Same.
so that is the problem. That is the main problem. What do you do when you don't have money, right?
Yeah, I remember when I moved to the UK from France, I was shocked at how cheap the chocolates were. Because in France, when I was a student, apples were much cheaper than a Mars bar. In London, it was the other way around. Buying a dairy milk chocolate was cheaper than buying a decent amount of fruit.
It still is, yeah.
Yeah,
you're right.
which is crazy.
It's crazy. It's crazy. So it all starts, it's you have to start.
Or the water is the same price as buying Coke and a fizzy drink, which is crazy.
Which in Africa, they put more sugar. I don't know if you know this. Fizzy drinks have more sugar to give more energy in poor countries.
Gosh,
yeah.
Okay.
So when you, I mean, I don't drink it, but when you drink a Coca-Cola down there, you're like, oof, this is so sweet. And that's the reason why.
So what is a basic routine we should all be following for a healthy mouth?
So first of all, going to the dentist regularly. I would say once a year. I would say every 6 months.
Yeah.
Hygiene's every 6 months, no matter what. And if you have an added issue with your gums, every 3 months, right? But if you, just for regular hygienes, every 6 months, and the same with dental checkups. Make sure once a year you get x-rays done, because things change, we change, and we need to know what's underneath. Something clinically might look amazing, and then you take an x-ray and you're like, what happened here? Okay. Because, I don't know, for example, some people go through a time where they're depressed, and then they eat many more sweets, or they go to bed without brushing their teeth.
I see.
And develop cavities.
Yeah.
And a cavity takes no time to develop, right? Flossing, for sure. It's very important. I know everyone hates it. Everyone's like, I use this instead. No. You have to floss. Use TP brushes if you need to, if you have space. And mouthwash. Again, a mouthwash that it's a healthy mouthwash with no alcohol, with, no SLS. There's no one of these colorful mouthwashes that you get out there like Listerine. Do not use it, please.
So please talk about this, because I was trying to explain to my children that these mouthwashes wipe out the good bacteria.
Yes.
So let's talk about, because so many people use poor quality mouthwash thinking it's a good thing, but they get rid of good bugs.
Totally. So you have to think of the saliva. The saliva is what protects teeth, right? That's why I always insist. So once you pass 60, 40% of over 60-year-old people, they tend to have less saliva because they're either on, high blood pressure tablets, depression, or hay fever, or many tablets that you take that create an environment where there's less saliva. So if there's less saliva, the teeth are not protected, right? So at night, obviously you don't talk, you don't produce saliva.
Yeah.
So the time when you have to really be on top of your oral hygiene is in the evening.
Yeah.
In the morning as well, but in the evening, and ideally after lunch as well, you should brush your teeth. That's number one. So you have to generate more saliva, drink more water. Patients that have cancer definitely have to drink much more water than those that don't, because the medication decreases the saliva production.
Okay.
And then the mouthwashes. So I think the healthiest mouthwash ever is salt water, for example. It doesn't taste very good, but salt water is fantastic for gums. I'm using one now from a brand called Guru Nanda, which is all essential oils from this American, well, he's Indian, but he lives in America. And he had cancer, and he decided that he was going to cure himself through Ayurveda. And sure enough, he went back to India, and he did.
Amazing.
So then he developed a brand of all holistic products, including a mouthwash that I love. So it's very concentrated. It's pure essential oils.
I'll look it up.
Yeah. I'll give you.
But the water and salt thing we do when we have a sore throat,
It's
gargle.
antibacterial.
Yeah, it's antibacterial. Of
It's
course, I never
antibacterial.
thought of that. I'm going to start using that as a mouthwash.
Yes.
Have my sea salt by the sink.
Green tea is fantastic, but green tea will stain your teeth, for example, right?
I
But
drink
you can
a lot of it.
Yes.
Oh, okay.
So coconut oil is the technique that they use, the pulling oil, the famous pulling oil. The problem is that you need a good 10 to 15 minutes of, gargling around.
Yes.
So who has time to do that? Yeah.
My eldest son,
Oh, he does?
believe it or not, he's going to kill me when he watches this. Hopefully he doesn't. He's asked me for coconut oil to do oil pulling at school.
Really?
I said, but 2 minutes don't work. You need to do longer. He said, I don't mind.
10, 15 minutes. And it whitens your teeth as well.
So
coconut
that's what
oil.
he said as well.
It does.
He said it's going to whiten my teeth. And I was like, okay.
But it's true. It's true.
I'm like, he's my kid after all.
Exactly.
The apple doesn't fall far from the tree.
But you can give him the sachets that come already.
Okay.
Don't give him the whole jar. And
I gave
get
him the jar.
with a spoon. It's going to be the weirdo at school. But those things, the same as toothpaste. Toothpaste that don't have same SLS, triclosan, that don't have... The fluoride is debatable.
Yes,
right?
I know.
It's very debatable.
Yeah.
Because there is link to say that it's not that great
for thyroid health.
For thyroid health.
Yeah.
But I always think it's the
for
quantity.
Children. Yes, I see.
Like
everything.
Like everything. So if you have tendency to have caries because, for example, your saliva is acidic or your enamel is weaker. Mm-hmm. So I would say, okay, once a year, you can use a toothpaste with fluoride to protect your teeth. You're not using it on a daily basis.
Yeah.
So, but
Good
the same
idea.
with children.
Good idea. It's all about how much.
It's all about how much. Like for children, for example, the same thing. If you give them water that has fluoride, then the toothpaste, then you add tablets, you'll end up too much, and then you'll end up doing the opposite, and they'll have white stains in the teeth, fluorosis, because excess of fluoride.
Yeah.
So everybody's different. Yeah, everybody's different. My brother is same mother, same dad, and he has very weak enamel, so he has tendency to develop a lot of cavities, but he has gut issues.
Interesting.
Yes.
Interesting.
Yes.
And how do you boost the amount of saliva that you produce? Is there anything we can do?
Drinking water, sugar-free chewing gums, for example.
Okay.
Because
Just
to chew
stimulates
it. Yeah. And water, keeping yourself hydrated.
So people above 60 years old definitely make sure you stay hydrated.
Yes. I mean, if they don't have if they don't take any medication, then you could do normal life. But it's the medication that creates
causes
this.
that.
Yes.
But you see, it's funny how we never think of the impact of these things because there are a lot of things people take, like, against hay fever or for a little headache. And although I'm a daughter of a pharmacist, I've always been, if I can sustain a pain without the med, I'll do it.
Yes, me too. Breathe through it.
Yeah, if I can. And people are like, just take a paracetamol. I'm like, there's downside to everything.
I agree. And then the body gets used to it, you know? And and if you get used to it, you're not going to generate an immune response like you should. So definitely stay healthy.
Sandra, it's been such a pleasure having
you with us. Thank you. I want to keep going.
We can keep going.
Thank you so much.
Is there anything else you'd like our listeners to know or to keep in mind when it comes to oral health?
The one thing I didn't tell you, so every 3 months you should be changing the head of your toothbrush or the toothbrush itself.
Of course.
Definitely. That's something that I missed. Yes.
I have a question.
Yes, tell me.
Every time I get motivated, I buy an electric toothbrush and then I hate it. I don't use it and then I put it in the bin. Is it okay to stay with manuals?
It is when you have a good technique. Definitely.
Okay.
Definitely. I have patients that don't have electric and they're amazing. They have a great oral hygiene. It's more, I would say, the electric one to use it at night, again, because it's when you spend more time.
Yes.
Washing your face, taking a shower, doing everything. So then if you have an electric one, I don't intend that you use it all day long, but at least at night, yes. And then the manual for the rest of the day. But if you have a good technique, fine.
That's a good idea. I can make that compromise. Yes. I can do the evening part of my skincare routine, but in the morning, definitely I haven't got...
Put your favorite song on, which is 2 minutes, right?
Yeah.
And then until it doesn't finish, you don't stop brushing. That's a trick. But I'm actually developing at the moment electric toothbrush, an on-the-go electric toothbrush.
Amazing.
Yeah, that fits in a handbag.
But that is a genius idea.
Yes, let's not give it away.
Okay.
But
I hope it's great
it
success.
solves a problem. It solves a problem because when we travel, the biggest, you're always like, oh, the toothbrush, and then I have to the charger. And that's why. So.
And that's how you lose the habit. That's how I lost the habit.
All of us.
It's because at the beginning it's there, and then you don't take it because it's bulky, and then you've lost the habit. Yeah. And it's so quick to lose a good habit.
Straight away. It takes 21 days then to put it back in,
Yes, exactly.
Anyway, thank you so much for having me.
Thank you. It's been so interesting. And I hope everyone goes and does all the checks. And I'm definitely going to go and get the scans done.
Yes.
You'll see me soon.
Exactly.
Thank you.
Thank you. Thank you so much.